You are wide awake at 2 a.m. It wasn't a loud noise or a nightmare that pulled you out of sleep. It was your mouth. It feels like you swallowed a handful of dry dust or sand sometime in the middle of the night. Your tongue is practically glued to the roof of your mouth, and your lips feel like you've been wandering through a desert for days. You stumble toward the kitchen for a glass of water, gulping it down just to feel human again. Most people think this is just a normal, annoying part of getting older. They brush their teeth, splash some water on their face, and ignore it. But that is a mistake. That bone-dry feeling is actually your body's smoke detector going off. It is a specific warning note from your system, and today we are going to read that note line by line. The medical name for this condition is xerostomia. It is far more common than you might think, affecting roughly 1 in 5 people in the general population. But as we age, the numbers get staggering. Nearly half of all adults over the age of 65 experience chronic morning dry mouth. To understand why this matters, you have to realize that saliva is not just spit. Your body is a high-tech factory that produces between 1 and 2 liters of this advanced fluid every single day. Think of your mouth as a fortress and saliva as the army that protects it 24/7. Saliva coats your teeth like invisible armor to prevent decay, neutralizes harmful acids, and contains enzymes that begin the digestion process before food even hits your stomach. It even carries antibacterial compounds to fight off infections in your throat. When your saliva production drops by even 30%, your body's primary defense system essentially goes offline. In over 80% of cases, dry mouth isn't the actual disease, it's the downstream symptom or the signal that a much larger fire is burning somewhere else in your body. There are 5 primary fires that your dry mouth smoke detector is usually pointing toward. Cause number 1, the medication puzzle. This is the most frequent culprit for adults over 60. It isn't a deficiency or a natural part of aging, it's the contents of your medication cabinet. There are over 400 to 500 different prescription and over-the-counter medications that list dry mouth as a primary side effect. We are talking about everyday drugs, blood pressure medications, especially diuretics, antihistamines for allergies, antidepressants, muscle relaxants, and even common pain relievers. These drugs often work by blocking neurotransmitters, the chemical messengers your brain uses to tell your salivary glands to get to work. It's like someone cut the phone line between your brain and your mouth. The danger multiplies when you take more than one. Research shows that seniors taking 5 or more daily medications have nearly double the rate of severe dry mouth compared to those taking only 2. It creates a domino effect where one pill causes dry mouth, which leads to cavities, which leads to more medication for pain, drying you out even further. Cause number 2, the silent nighttime thief. If you wake up feeling like your mouth hosted a wind tunnel all night, you might have obstructive sleep apnea, OSA. This happens when the tissue in your throat collapses and blocks your airway during sleep. Your body panics and defaults to mouth breathing to survive. This constant airflow evaporates your saliva at a rate that nasal breathing simply doesn't. But the dry mouth is just the table of contents. The real story is much scarier. Untreated sleep apnea significantly raises your risk for strokes, irregular heart rhythms, and even cognitive decline. If your dry mouth is paired with loud snoring, morning headaches, or feeling exhausted even after 8 hours of sleep, your body is begging you to investigate your breathing. Cause number 3, the blood sugar connection. Your dry mouth could be the first warning sign of undiagnosed diabetes. Approximately 1 in 4 people with diabetes don't even know they have it yet. When your blood sugar is consistently high, your kidneys go into overdrive trying to flush out the excess glucose. To do this, they pull moisture from every other tissue in your body, including your salivary glands. This creates a state of systemic dehydration that no amount of water can fix. If you are also urinating more frequently, feeling unusual fatigue, or noticing that small cuts are taking a long time to heal, you need to check your blood sugar immediately. Cause number 4, the dehydration deception. As we age, the thirst center in our brain, the hypothalamus, becomes less sensitive. You can reach dangerous fluid deficits of 2% of your body weight without ever actually feeling thirsty. Essentially, your body stops telling you it needs water until it's already in drought management mode. When this happens, your body releases histamine to prioritize water for your major organs, pulling it away from your joints and your mouth. This is why your mouth feels like sandpaper in the morning. It's the only outward sign that your system is running on empty. Cause number 5, the overlooked autoimmune condition. If you are a woman over 40 or 55, pay very close attention to Sjogren's syndrome. This is an autoimmune condition where your own immune system mistakenly attacks the glands that produce moisture, specifically tears and saliva. It is massively underdiagnosed because the symptoms, dry mouth, dry eyes, and fatigue, are often dismissed as just getting older. On average, it takes patients nearly 5 years to get an accurate diagnosis. Left untreated, it can eventually damage your joints, kidneys, and lungs. The most important thing to realize is that chronic dry mouth is never just a mouth problem. It shifts the entire environment of your body. Without saliva to balance the pH in your mouth, the environment becomes highly acidic. This turns your mouth into a playground for harmful bacteria that eat away at your tooth enamel and cause gum disease. Furthermore, because digestion begins with salivary enzymes, a dry mouth means your stomach has to work twice as hard to process food, leading to indigestion and poor nutrient absorption. It is a systemic failure that starts with a minor morning annoyance. Why it matters. If you ignore this warning, the damage can become permanent. Salivary gland cells that are destroyed by autoimmune attacks or radiation do not simply grow back. Chronic dryness can lead to oral thrush, a painful fungal infection, and can make eating so difficult that it leads to malnutrition. In the case of sleep apnea or diabetes, ignoring the dry mouth signal means you are ignoring conditions that could lead to heart failure or kidney damage. Your body is giving you a head start. Don't waste it. Here is your immediate action plan to fix this starting tonight. Medication review. List every supplement and prescription you take. Ask your pharmacist, could this combination be drying me out? You might only need to adjust the timing of your dose to find relief. Hydrate by the clock. Since your thirst signal is no longer reliable, drink 8 glasses of water spread across the day based on the time, not how you feel. Optimize your environment. Use a cool mist humidifier in your bedroom while you sleep. Try xylitol. Look for oral rinses or sugar-free gum containing xylitol. It stimulates saliva production while killing the bacteria that thrive in dry environments. Change positions. If you snore, try sleeping on your side instead of your back to keep your airway open and reduce mouth breathing. Don't let your health go dry. Listen to the warning, act on the signal, and take control of your vitality today. Thank you for watching this Green Health video, and I'll see you in the next one. Green Health Cares.